Hello, I'm Dr. Rajat Gupta, board certified plastic surgeon working in New Delhi, India. What I'll be talking to you today is about a very common problem in males, that is gynecomastia. Do you think you have excess weight on your chest, or your nipples or areola are much bigger than a normal man? You are ashamed of wearing tight t-shirts because your chest look feminine and the breast shows, then you are suffering from something called as man boobs or gynecomastia in scientific terms. This is a very common problem in males. In fact, more than 15 to 20% of males as of now in India suffer from it. And when I say suffer, it is not only a physical attribute, it's a much more emotionally draining problem. These boys do not wear tight t-shirts because their chest becomes much more prominent. They sit droopy with shoulders down, otherwise their chest becomes much more prominent. They do not go for swimming or beach holiday with their friends. Aim of the treatment of this gynecomastia problem is that these boys should have a flat chest but should not have any scar. Let's first discuss about why this problem happens. Most of the time, the reason of gynecomastia problem is the hormonal changes happening during adolescence. When the boys are growing in the teenage during 13, 14, 15 years of age, there are a lot of hormonal imbalances happening in every male's body. You would have noticed that certain boys, their voice also becomes feminine for a few months during their growth phase. Now, during that phase, in some boys, some breast tissue gets formed during these 13, 14, 15 years of age. Now, if they happen to gain weight more than normal, then the fat can also deposit around this breast gland. Now, this breast tissue or gland or chest shape usually does not form like a full feminine breast because this hormonal imbalance is only for a few months. Now, this chest shape actually does not become as big as a female breast because this hormonal imbalance is only for a few months. So usually you would notice that these boys, after they have gynecomastia, they have their facial hair or chest hair. That means their hormonal imbalances have been corrected because these are called as secondary sexual characters, the facial and the chest hairs. So if you get their hormonal profile done when they are now 20, 25 or 30 years of age, that would be normal. So there is no reason of getting hormonal profile done for any person who has gynecomastia because the hormonal imbalance happened only for a few months during their growth phase and now it's normal. But during that time, it made a breast tissue. Now, important thing to note is the problem is the breast tissue along with some fat. But since it's a tissue or a gland, it cannot be treated by any medicine, drugs, exercise, injections, or any other non-surgical procedure. So, surgery is the only procedure which can actually remove your breast tissue along with the fat. And this will be permanent cure. There are certain other indications in which a gynecomastia happens, which depends upon if the patient has any liver problem or is on some drugs like steroids. But most of the patients who come to my practice, they do not have such complaints. And most of the patients just have gynecomastia because of hormonal issues which happen during their adolescence. Now let's talk about how to treat this problem. Remember, I talked about that people who have gynecomastia, they do not go for swimming or beach holiday, and neither do they wear tight t-shirts, they sit droopy. Now, the aim is to give them a flat masculine chest. If we remove the breast gland and fat from the chest, but give them a scar on the front of the chest, then they will still not go for swimming or beach holiday. So my concept of treating gynecomastia is, and I developed a technique for this, it's a very special technique in which I'm able to deliver a flat masculine chest to our patients, but without any visible scar on front of the chest. Now, how do we do this? The way we do this procedure is we give a very small incision, which is less than 5 millimeters on the side of the chest, so that this cut is not visible if someone is walking bare chested on the beach or going for swimming. Now, through this small hole, we use a tool called as micro air. Now, this tool goes inside and breaks the gland into small pieces. So small pieces that I can simply tease out the small tissue from this small cut. We remove all this breast gland through less than 5 millimeter of cut. At the same time, we also use a tool called as Vaser. What this does is, it goes inside, melts the fat, as well as tightens the skin. Now please understand, once we remove the fat and the gland from a patient who has gynecomastia, we also want the skin to shrink, get tight, and stick to the pectoral muscles underlying, so that the pectoral muscle and the skin looks nice. Now what happens is, once you remove the fat and the gland with the help of micro air, through this small cut of 5 millimeters, the skin also tightens. And we are able to deliver consistent result for our patients and make them look masculine. There is no cut or incision in the front of the chest. I repeat, this is very, very important, because some people may not understand this while they are having gynecomastia and planning for surgery. But once you have had the surgery done, after that, you think, do I have any stigmata of the surgery being done? Can anybody who meet me or see me understand or see whether I have had the surgery? That is also very important. Post-surgery, what is the mindset of the patient? Are they able to wear any clothes? And are they able to go bare chest for swimming or beach holiday? If you give them a flat chest but a scar on the front of the chest, they'll still not be able to do so. So our technique helps them achieve a flat masculine chest but without any scar. Obviously, this technique needs some tools, which is micro air and Vaser. Now, in our practice, we have done more than 2,000 gynecomastia surgeries. Most of our patients come in the morning of surgery, get their surgery done, and go back home in the evening. And from next day, they are able to resume all their daily activities. They can do all their homework, daily chores, and they can resume their office as well from the next day. They do not have much of pain. There is a small amount of discomfort, which is like a tightness because the skin is now tight, which they feel for next 4 to 5 days. My patients after 1 week can start their cardio exercises, and after 2 weeks can also do weight training. So after 2 weeks, they are up and about and doing all the kinds of exercises, and they are feeling normal. Of course, the result keeps on improving because the skin tightening and the swelling keeps on settling down over next few months. But immediately, even on the day of surgery, they can see a huge difference. My patients have told me it's like a rebirth. They feel much more confident, their body image issues are settled, it helps in their professional as well as personal life. So gynecomastia problem is not only a physical problem, it's a lot of mental and emotional problem from someone suffering from it. We help you achieve the best version of you possible, and gynecomastia is a problem which any man who is suffering from it should not, because it is easily curable. And visit a board certified plastic surgeon near you. Use these tools to give you aesthetic result so that you do not worry about this problem. I've tried to answer most of the questions which are asked by my patients. If you have any more questions, please write into us and we'll be there to help you and solve all your problems. Thank you.